Facts Behind Events at 3 Mile Island, Unit 2, Part 2, Emergency Preparedness and Public Response, presented by Clint 6. Emergency Response Gaps during TMI-2. There were significant shortcomings in emergency preparedness at the time of the TMI-2 accident. Regulations for the utility were broad and lacked the proper structure to ensure communications to public officials were clear and well understood. As a result, the emergency plans in the industry were of highly uneven quality and would result in a wide variance of implementation. The utility had no predefined communications established for a specific category of emergency. Additionally, the methodology used by the utility to communicate evacuation recommendations to public officials were strange and unnatural. For example, the method to calculate an evacuation area were based on extremely high dose rates, resulting in a recommendation to evacuate a relatively small area. In the event of an accident more serious than the TMI-2 event, individuals outside the evacuation area would still receive massive doses of radiation. The state and local government protocols following notification of an accident were not well defined. In the event a utility communicated an accident to a public official, there were no regulations requiring development of specific plans for each category of accident communicated to the public by the utility. Because the utility had no requirement to provide predefined communications based on accident category, local and state officials could not develop detailed plans in response to a specific emergency. In the case of 3 Mile Island, there was almost a total lack of detailed plans in local communities. This lack of predefined protocols resulted in a lack of communication at all levels during the event. Key decision makers lacked awareness of critical information, and as a result, they were slow to realize the significance and implications of the event that had taken place. Post-accident improvements at the utility. Following the accident, significant changes were made to improve emergency response at the utilities. The Nuclear Regulatory Commission issued new Reg 0654, which provided regulatory requirements in 3 key areas. Number 1, criteria was established to require written emergency plans. 2, event classifications were recategorized into 4 classes of emergency action levels. And 3, regulations were put in place to require emergency response centers with direct access to critical information. Written emergency plans. Criteria was established to require written emergency plans with emphasis on accurately communicating information to the government and public as quickly as possible. Plans were enhanced to provide emergency planning zones that were site-specific and provided better evacuation recommendations to the public. 2 emergency planning zones were created, a 10-mile zone and a 50-mile zone. These emergency planning zones could encompass multiple local municipalities and multiple states. Each utility was required to develop an integrated plan to coordinate communications with all entities within their planning zones. One notable change in the strategy was the use of predictive modeling to determine the impact of an event. Utilities were required to develop strategies for protection of the public based on predictive models of core damage and potential radioactive releases. This was a change from previous emphasis on utility response of measurement of actual levels of radioactivity before recommendations were given to off-site organizations. Key attributes of the written plans. The Nuclear Regulatory Commission identified in writing the specific attributes required of each site's emergency response plan. Key attributes included specific criteria for plant system and effluent parameter values that would trigger entry into an emergency action level. Notification protocols were established and time requirements required for the utility to notify state, local, and federal organizations. On-site capability and resources required to mitigate events and continually assess event status were established. Protective action recommendations and their bases were required to be in writing with thresholds for implementation readily available to key decision makers. Method of accounting and relocating non-essential site personnel for their own protection were established. Creation of standardized emergency action levels. Changes were made to event classification, event categories, and communication protocols. Prior to the TMI-2 accident, emergency action levels and categories of events were typically site-specific thresholds. The most significant change was an adoption of standardized emergency action levels and event categories across the industry. The 4 emergency action level thresholds adopted were notification of unusual event, alert, site area emergency, and general emergency. The rationale for the creation of the unusual event and alert classifications was to provide early and prompt notification of minor events that could lead to more consequential events in the event of equipment failures or operator error. These early notifications allow for a better response of preparation, communication, and monitoring teams. Categories of events such as abnormal radiation levels, fission product barrier degradation, malfunctions, and hazards were also established. These various categories provided industry standard thresholds for triggering an emergency action level within a given category. This provided significant enhancement and structure for gathering, classifying, and communicating the specific risk of a given emergency to ensure consistent communications with key stakeholders in local and federal governments. Of emergency response centers. Each utility was required to establish emergency response centers to better support the operating crew, provide ongoing monitoring and communication with the main control room and external stakeholders. A technical support center was established at each facility. The purpose of this on-site facility is to provide access to plant management and technical support to the reactor operating personnel during an emergency. An operations support center was also established at each facility. The Operations Support Center is separate from the TSC and is in constant communication with the control room and the Technical Support Center to support duties in the event of emergency operation. An emergency operations facility was established in a nearby off-site support facility. The emergency operations facility has access to plant technical data and plant records to assist in diagnosing plant conditions and evaluate potential or actual release of radioactive materials to the environment. Multiple data systems were created to provide real-time access to key information to monitor and assess plant conditions as the accident progresses. These systems are available to site and off-site organizations and were required to be designed and constructed to provide a high degree of reliability necessary to support emergency response. Post-accident improvements in local government response. The NRC provided a framework for coordination between the utility, state, and local organizations, but delegated the emergency planning specifics to those groups. The basis for this decision was that local organizations would have better awareness of their specific needs. The NRC did require each emergency center to include written agreements referencing the concept of operations developed between the federal, state, and local agencies and other support organizations having an emergency response role within the emergency planning zone. The agreements were to identify the mutually acceptable criteria for their implementation and specify the arrangements for exchange of information. These agreements are provided in an appendix to the site emergency plan and are provided to the Nuclear Regulatory Commission to provide oversight and review. Measuring effectiveness and evaluations. To ensure effective implementation and proficiency with implementation, the NRC established guidelines for training, drills, and evaluations. This was perhaps the most important aspect of the changes that were implemented to the emergency planning process after the TMI-2 accident. Evaluation criteria was developed to ensure consistent evaluation of emergency preparedness across the industry. Additionally, a series of metrics to measure the health of an emergency plan program were implemented at each station and measured objectively by the NRC. Operating experience obtained through training and actual events are shared and promote a culture of continuous improvement in the emergency planning process. These drills and evaluations have improved emergency response and contributed to significant enhancements in industry guidance. In 2013, the NRC approved Revision 6 to the Nuclear Energy Institute's Emergency Response Template. These 6 revisions and the continuous improvements they have brought to the industry demonstrate the industry continues to pursue excellence in emergency preparedness. References utilized for this portion of the project were the Kemeny Report of the President's Commission of the Accident at 3 Mile Island, 1979, New Reg 0654 Revision 1, 1980, New Reg 0696, 1981, and NEI 9901 Revision 6 by the Nuclear Energy Institute.